Fermin is probably the nicest individual I've ever met. He's so humble, truly cares about the patients. He gets down at their level, works with them, listens to them, which is so imperative in our business. As an employee, he's a great teammate, tries to educate the younger staff members, but also works well with the older members of the staff as well.
He brings a lot of experience, which is helpful both for the outcomes of the patients, but also for the younger staff. And we do have a fair number of new grads and younger staff that he's taken under his wing and just helped to grow. And that's just good for patients in general.
My plan was to work here as needed, as an as-needed therapist. So I was kind of shadowing Fermin, watching him, learning the ropes here. And as I was watching Fermin, I realized that this was the place I wanted to be.
Leadership is not necessarily taught. It's just inherent. And with him being humble, people automatically gravitate to him, not just patients, but staff as well.
One day I was working and I had heard Fermin say something that just kind of gave me that flashback moment. I thought I had heard that before, and come to find out that he had taken care of my grandma when she was in a nursing home, and he helped her, and she's home now after her fall, and she's been home ever since. But I remember watching Fermin there taking care of my grandma and thinking I wanted to do inpatient rehab and I wanted to work with older adults because I loved the way that he took care of her.
Fermin really encompasses our value of doing what's right. As a leader, I have confidence that no matter what I give Fermin as a task, that he will not only carry it out, but do it with exceptional quality. That gives me a lot of confidence.
I believe we need to be strong. My initial impression of a strong team came early to me because I did have the chance to experience that. I had mentors, I had passionate coworkers, team members that just really enjoyed being there wholly for the population that we were serving. I kind of carry that with me, and I feel like now that I am the older therapist, supposedly the seasoned therapist, that I am responsible for kind of passing that on to the newer generation. So I really like taking someone that's new, that is seeking information, someone who wants to grow in the profession, and I'd like taking them under my wing and just showing them the few things that I know. I do feel that we have a very supportive administration here. Rob and Maria, they definitely provide the department with the tools that we need. OT, I think, is unique in the sense that it goes beyond just using biomechanical approaches, meaning just treating a body or a limb. It goes into recognizing what the person's lifestyle is, what they were like before, what their interests are. It's such an interesting field. I've run across a lot of folks that are old world veterans, old miners, teachers, all walks of life, nuclear physicists, engineers, all sorts of all backgrounds, and it's just so interesting. So I have to take all that into consideration when someone invites me into their life that way. I include that in what I do with them.
Congratulations, Fermin. A well-deserved award.
Congratulations, Fermin.
Congratulations, Fermin.